Hello, everybody. This is Brad, the current chair of the CAC. Did everybody ordered? I did not. I ended up getting a gift of lunch from a friend, actually a work employee, last night, and so I'm enjoying some pozole. But I hope everybody. I lucked out. I hope everybody else took advantage of ordering something. And thank you to the Health Council staff for setting that up. So introductions, Kelsey.
Sure. Hi, this is Kelsey Seymour. I am the Administrative Assistant and Media Coordinator with the Central Oregon Health Council, and my pronouns are she, hers, and her.
Kelsey, would you mind going down the list and calling off folks' names?
I'm happy to, as soon as my computer does what I tell it to. Okay, Elizabeth. Elizabeth, are you able to introduce yourself? Are you on mute? Okay, we're going to come back to you. Teresa.
Hi, I'm Teresa Olander. I'm a community representative, and my pronouns are she, hers, hers.
Okay, great. I'm going to try and pronounce this correctly. You let me know if I got it wrong. Is it Tanya or Tanya?
Hi, one
Tanya
second.
Curiel?
I unmute myself. Hi, my name is Tanya Curiel, and I'm the new Regional Outreach Coordinator for Central Oregon with OHA's CPOP team.
Awesome. Thank you for being here.
Thank you.
Ken Wilhelm.
Good afternoon, everybody. Ken Wilhelm with United Way. He, him, his.
Thanks, Ken. Vicki.
Hi, good afternoon. Vicki Ryan, Kirk County Public Health. I'm the Emergency Preparedness Coordinator and the Public Information Officer for the county.
Welcome. Elaine.
Elaine C. with Mosaic Medical, she, her, hers, Community Advisory Council member.
Thank you. Kristen.
Hi, Kristen Tobias, Community Health Coordinator for Pacific Source Community Solutions, Central Oregon.
Welcome. Larry. Larry, you're on mute. All right.
Hi, this is Larry Kogosik, CAC member, and he, him, his.
Thanks, Larry. Leslie.
Hi, Leslie Neugebauer, Central Oregon CCO Director at Pacific Source.
Welcome. Linda.
Linda Johnson, CAC member and Health Council member. She, her, and hers.
Mandy.
Hi, I'm Mandy Seeley, she, her, they, and I'm a CAC member and a housing advocate in Sisters.
Welcome back. Maria.
Hi, everybody. Maria Waters, OHA Regional Outreach Coordinator for now. Good to see you guys.
Natalie.
Hi, I'm Natalie from Jefferson County Public Health, Perinatal Care Coordinator. She, her, hers for pronouns.
Awesome. Miguel.
Hello, how are you? Miguel Ángel Rada, Pacific Source.
I love all your instruments in the background there. Tom.
Hi, Tom Kuhn, Deschutes County Public Health.
Okay, Elizabeth, are you able to introduce yourself now? Okay. Is there anyone who is not a member of the Health Council staff who I was not able to introduce?
Well, I'm a CAC member. Sorry.
Oh, there you are, Elizabeth. Thank you so much. Nice to see you.
Okay, thank
anyone
you.
else? Okay, I'm going to run through the Health Council staff. Michaela and then Renee.
Hi, Michaela Arsenault, project manager at the Central Oregon Health Council. My pronouns are she, her, and hers.
Hi everyone, Renee Worth, also a project manager at the Central Oregon Health Council, and my pronouns are she, her, and hers.
Awesome. Gwen and then Donna.
Hi, Gwen Jones, she, her, hers, project manager.
Good afternoon, everybody. My name is Donna Mills. I serve as the executive director for the Central Oregon Health Council, and my pronouns are she, her, and hers.
Lauren Katsudik's here too, from La Pine.
Lauren, I knew we had somebody else on the phone. My apologies. Thank you so much for saying so. All right, and I believe that is it. Speak now or forever hold your peace if I missed you.
Okay.
Okay, go ahead, Brad.
Thanks, Kelsey. All right, it is time for public comment. Is there anybody with us who would like to contribute to the public comment?
Hi, Brad. I would love to have a moment if that's okay.
Yes.
Many of you may have already heard that we are really excited to have Tanya, who introduced herself earlier, join us as the regional outreach coordinator for Central Oregon. The original plan was for the two of us to tag team in this region to offer more support to Central Oregon community organizations. However, I've been recently asked to step into a statewide role, liaisoning between faith communities and the state of Oregon. And so I will be transitioning out of this role, effective pretty immediately. But I want to make sure that we transition well to Tanya. And then they will be hiring a second additional regional outreach coordinator to backfill my position. So there's some changes on our team, but I'm not disappearing. I'll still be with the state, and I'm sure our paths will be crossing often, but I will be pausing attendance of these meetings and some others. So just wanted to provide a little update on the OHA community partner front.
Thanks, Maria. Thanks for everything you've done in your role as regional outreach coordinator for Central Oregon. Anybody else who would like to make a public comment?
It's Elizabeth. I met a young girl, she's 18 or 19, at Best Buy. She's in college, and talked to her about CAC membership, and she was very interested. So I'm going to follow up on that. She's about 18.
Fantastic. So
Yeah.
you'll-
So we'd get a student
Yeah,
as a CAC member. Yeah. So, okay. Thank you.
that's great. Thanks, Elizabeth. Anyone else with a public comment? I'll take just a minute to very briefly share with you that we just, the last 2 days, we've been presenting, Latino Community Association has been presenting the findings from a research project we did in collaboration with the Oregon Center for Children and Youth with Special Health Needs. And we basically did focus groups with Spanish-speaking Latino families who are caring for parents who are caring for children and youth with special health needs. And one of the positives that came out of that, there were many challenges and issues that came up that need to be addressed by our health system. But one of the strongest positive comments was pretty uniformly across the 22 families that we served. They spoke highly of OHP and the Oregon Health Plan and the insurance coverage for their the care for their kiddos with special health needs. So that was good to hear. So I just wanted to share that. All right, if there's no more comments, we will move on to approve our meeting minutes from our last meeting. Did we want to go through the kind of the action items that we identified. I don't know if we can bring that up on the screen, or we've gotten into the habit of doing that before we approve the minutes. So kind of going through. We able to bring that on the screen?
Bringing it up right now.
Okay, okay.
Do we have the minutes in the meeting packet? Actually,
Yeah, I
I
think
thought I had.
they're at the end, I think.
Okay,
At
thanks.
least that's where they are in my packet.
All right. There we go. Thanks, Brad.
Yeah. So is Kristen with us? Kristen Tobias?
Hello, yes, I am. So I think, Teresa, we connected and I hope you found a good solution. And Lauren, we might still need to connect, although our conversations around dental access within Pacific Source continue. And we are very aware that dental access in South County, Northern Klamath is not good. So we do continue to have those conversations internally and trying to figure out how we can bring more providers into our network to serve the more rural communities that are lacking robust dental services currently. So those conversations are ongoing for sure.
It looks like Kristen will be talking about dental access later in our meeting also. So thanks, Kristen. The Unite Us, Courtney will follow up with me offline about Unite Us. That happened. Just so you know, I can now log in and we're on our way. So that's, thanks for that. It was good to have Courtney with us the last meeting. Gwen, demographic data, we're going to cover that later in the meeting, yes? Demographics, yes. Okay. Are there any reasons CAC members have for not making a motion to approve the minutes?
No.
Would someone like to make a motion to approve the minutes?
So moved. Linda Johnson.
What's that?
I said so moved, Linda Johnson.
Okay. Is there a second?
Second.
Second by Larry. All right, thank you. All right, there are a few announcements. Thank you, Michaela, for preparing this for me. That's very helpful. Trey Madden was in a serious car accident. Trey is a CAC member, community representative. At this time, he plans to move back to the East Coast to be with family once he has recovered enough to do so. Our thoughts and best wishes are with Trey. Very unfortunate. Whoops, sorry. On a positive note, Mandy Seeley is back with us. So we're glad to have you back, Mandy. I'm guessing that it's the meeting time that helped you rejoin us. Is that correct? Changing our meeting time?
No, actually, I also had planned to move back to the East Coast to be with family. However, as most of you know, the housing crisis isn't specific to Oregon, and we were unable to find housing, so we decided to stay here.
Oh. Well, good for us. The CAC work plan format was approved electronically by the CAC, Community Advisory Council. And a thank you from the staff. The Health Council staff has drafted Community Advisory Council presentation guidelines. That was sent out in the email from Michaela for those presenting at CAC meetings. The goal is to keep presentations understandable and maybe not. Is anybody else hearing that echo? Huh. I'm not sure if it's me or somebody else who's not muted, but I'll just continue.
I think it's Larry that's not muted because his name keeps coming up. So I think.
No, I'm muted. Or not now, but I will be in a second.
Thanks, Larry.
It might be me. I have a mute button on my car. I'm just covering the phone. It's Elizabeth. I hope it's not me.
We'll just continue and see how it goes. Thanks, Elizabeth.
Okay, sure.
The goal of providing these presentation guidelines is to keep presentations understandable and minimize acronyms and healthcare jargon, which I definitely appreciate. So everyone can contribute to the conversation. Michaela can send out a copy of the guidelines so you know what to expect. So those were sent in the CAC member email, but if anybody didn't get those and would like to get those, let Michaela know.
I haven't sent those out to everyone yet, so they did not receive them yet.
Oh, okay, sorry. You will be sending those out, right? To at least the CAC?
Correct. I think I just sent those to you and Larry to view.
Okay. If you RSVP'd for a lunch order, tell us how it went. Use the chat box to tell us how that went. Are you eating something that you ordered thanks to the Health Council? First time we've attempted doing this in conjunction with our virtual meetings. So the Health Council staff would like your feedback on how it went.
And we appreciate your patience in working with us. We had a lot of learnings as staff doing this at a lunchtime hour. So thank you all. We appreciate it. And do give us feedback. We want to continue to hear so we can improve it.
Thanks, Gwen. And with that, I will turn it over to Michaela and Gwen.
Thank you. Gwen, would you mind pulling up the slides?
Got it. Where was it? Here we go. Oh.
All right, so we wanted to spend some time today gathering your insights on how the community health projects process went, so that we can make adjustments for when we do this in 2021. And we hope that it's still somewhat fresh in your mind. It's been a couple of months, but it is 2020 and last month seems like a year ago. So I do want to start off with kind of doing a brief overview of the process, and then we'll get into discussion. So first thing, in kind of CCO language, this is called Community Benefit Initiative. But towards the start of this project, we renamed it Community Health Projects. So we'll be calling it Community Health Projects from here on out. So as a reminder, community health projects are community level projects focused on improving population health and healthcare quality. And it's really focused on addressing social determinants of health and health equity. Next slide. So in addition to that, community health projects are also meant to improve health outcomes, reduce health disparities, promote the efficient use of resources, really support the current work of the Regional Health Improvement Plan, promote and increase wellness and health activities, and improve the overall community well-being. So every year, the CAC will get about $250,000 to allocate. This year, we were surprised with an additional $700,000. And this came from kind of a percentage of the funds that clinics work to earn back by meeting certain health improvement targets. And OHA said a percentage of those funds have to be used for social determinants of health and health equity. So that got added to our pool of funds. So we ended up with a total of $950,000. And all of these funds each year have to be spent by the end of that year. Next slide. So we're on a timeline. So back in July, we sent out a request for proposals, and you decided to make the award range between $5,000 and $50,000. And at that time, we were still thinking that we only had about $250,000 to allocate. In August, you finalized the proposed scorecard, and in that scorecard, you wanted to score it based on like most impact addressing social determinants of health and health equity, health disparities, barriers to access, participation, and inclusion, as well as demonstrated project need and projects that serve rural communities. And so in September, you did your initial scoring of those applications, and then October is when you made those final decisions on all of the projects that we received. And we received 42 proposals. The total ask of all of those 42 proposals was about 1.6 million. So we had 950,000, so that's a difference of $720,000. Next slide. All right, and then kind of getting into more detail, because we received so many proposals, we broke you out into 4 review groups. And so each review group got about 10 to 11 proposals, and you used those scorecards to come up with your score. And then in September, we brought all those proposals back and put all those scores together, and this is kind of where they landed. And then in September, you decided to approve the top ranked scores and decline the lower ranked scores. And so we were really focusing on that, those middle ranked proposals. And we also brought you back information on which communities those proposals addressed, as well as which social determinants of health they addressed as well. And so then we had a conversation of looking at these middle proposals, what was really important to you, and that's when you really decided proposals that served rural communities. You wanted to prioritize that. So then we asked you to prioritize these 14 middle proposals, and which brings us to October. We brought you back how those middle 14 proposals were ranked. And so we had enough funds to cover the ones in green, and so you decided to go ahead and approve those. And then we had 3 that tied as far as the scoring, and so we had a conversation around that, and ultimately you decided to go with the 2 proposals that addressed homelessness, because you felt that that COVID would impact that more significantly than maybe the other proposals. And so that long process concluded in October, and you had allocated all of that $950,000. So that was kind of next slide. So that was very high level overview of the process, just to kind of remind you of what we went through. And so I was hoping that we could have a focused conversation, and I have a list of questions to really gather your insight around this process, so we can make those adjustments in 2021. But first, I want to see if there's any details that I missed that you thought were important to include about that process.
Anybody have comments that you wanted to include about the process? It's not sounding like it, Michaela.
All right.
Move on to the discussion.
All right. So I want to know what you liked about the process.
Say the scorecard. The scorecard was critical.
Scorecard.
Because what it did is it was really challenging but necessary to stay objective. And when you focused on just this section, and are they actually meeting the goal of the grant application one at a time and scored it, I felt it was helpful to stay objective. Because all of them are good programs, obviously, and they all have value, but I think it's really easy to get caught up in, well, I know about this program and this one's good and this affects my life and blah, 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 whatever. We all have stories. So I think having the scorecard was critical to say, stay objective, because that was what was fair to the applicants.
Thanks, Teresa.
Mm-hmm.
Myra agrees. Any other things that you liked about the process?
Well, I liked everything about it. I thought it was very clever and an amazing design to accomplish what I thought was impossible. I think I don't know if you remember in the beginning, I knew that there would be a tremendous number of applications, and I thought we were going to be overwhelmed. But I think you guys have just devised an amazing system. I'm just really impressed with it, and I thought it was just great.
Thanks, Larry.
I really liked the way you walked us through in a structured process to develop the criteria that would be each application would be evaluated against, including the size of the grants that we would be offering, or even though it was early on when we knew, or we thought we only had 200,000 and then it jumped to the higher number. I think the groundwork that was laid through that discussion about how much per grant. And then there was just a rich discussion about what are our priorities that went into the scorecard. Things like geographic distribution, targeting diversity issues, taking a wider look at what were the things that the grants are going to accomplish. That was really, really helpful. And then I liked the subgroups, that we didn't all have to review all the policies. Dividing them up into manageable review groups was helpful too.
Thanks, Linda. Those are good pieces. What about parts of the process that you didn't like?
I'm not going to say that I didn't like any of the part of the process. It was a good process, and giving away money thoughtfully is very hard. One thing that I think presented a little bit of a challenge was you kind of had to break it into separate groups to make it manageable and readable. That folks aren't going to read, all those proposals, or at least not thoughtfully. But it seemed that there was it's inevitable that you'll get some groups that are hard graders and others that are soft graders. And so I think where that showed up as a potential problem was that automatically, based on those first scores, a set of proposals were funded. And it seems like there ought to be some leveling mechanism for that. I don't know if it's to have, I'm not sure what to say, that if it's to come back and offer one more consideration in the larger group, that adds time, and when you're only meeting, once a month or so, that's really difficult. But and I'd be happy to brainstorm or chat with folks about maybe ways to provide that leavening.
Yeah, like another level of review, or more people reviewing. What other challenges?
Michaela, this is Linda. What I recognize as a challenge was the last 2 or 3 that came in just recently, which were separate from the bigger group that we reviewed in mass. It was easier to review the group in mass and to sort of get a sense of what a great application looked like and which ones were not adequate. And then far later, we got 2 or 3, and it was difficult to sort of get back in that mindset of what the application should contain. Even with the scoring, I found myself wondering if I was being too generous or too harsh.
You're talking about that second set of scoring was like the middle ranked proposals?
No, didn't we? We got 2 or 3, just some loose hangers on just in the last month. that we reviewed separate from the other groups, I thought. Because I had to print out the review, I had to go find the tool and print it out and write the applications.
Those might be RIP mini grants.
You might be right. Yeah, you might be right.
Okay. What are some other challenges that you faced about this process?
I think you already identified the issue early on and have already built in a correction, but not being clear between the applicants and the review panel about multi-year grants versus single-year grants.
Okay, multi-year grants. What about kind of like how heavy the lift was to review all these proposals?
I felt the volume was really large, like it was really difficult for me to set aside time to go through all the proposals thoroughly. So it almost would have been nice if we could have divided them up a little more between the members, kind of like sort of what Ken was saying earlier. But just, you know, it was just a large volume. It made it really tough.
Yeah.
Yeah, this is Brad. Especially when we came back together, you had kind of consolidated all of our responses, all of our gradings, and then we're all looking at this really long list of proposals that we only knew about 10 of them that we reviewed in our subgroups. So the rest are just kind of, I mean, it's difficult to look at a long list and know that you only really understand 10 of them and try to weigh all the others. So that's kind of, I'm not sure how we could have gotten around that. But that was hard for me.
What are the key elements to the process that we'd want to keep? Or what would you like to change?
You know, I appreciated that the staff didn't filter ones out. I mean, I think that would be an easy thing to jump in and try to do because there were so many, but although the lift was a lot, I think it felt more inclusive to be asking a variety of CAC members in these subgroups to look at them. So although it was a heavy lift, I appreciated that. And I don't know if I would want it to change.
Thanks, Elaine.
Yeah, and I think as somebody else mentioned, I think the scorecard was really genius and critical because it kind of simplified and helped us clarify the judgments that we were making and made it possible to quantify the judgments that we were making and really made the sorting out process a lot more efficient.
Thanks, Larry. So we are over time on this agenda item. If you have any more comments or suggestions, you can email them to me or you can call me. We'll be building the 2021 process with you. So if you feel like you haven't said all that you wanted to say, we'll discuss this more at a future meeting. So thanks, everyone. I am going to turn it back to Brad.
Thanks, Michaela. And thanks, everybody, for your feedback. We need to do one quick thing before we move on to the next agenda item with Miguel Herrada. We need to actually take a vote on the minutes, the approval of the minutes. I skipped that formality. So CAC members, if you could please. We had a motion by Linda and a second by, I think it was Larry. Is that correct? And would you please vote in the chat or by speaking up? Do all those who approve, please say yes.
Yes.
Or
yes.
write it in the chat. Okay, hopefully we're getting the rest in the chat. Is there anyone opposed to approving the minutes? Any more discussion? Okay, thanks everybody. It looks like the chat votes are starting to flow, and Elizabeth shared verbally, and I forget who else, somebody else. Larry? All right. Okay, thanks everybody. Our next agenda item is to look at plain language in the health equity plan with Don Miguel Ángel Herrada.
Yeah, thank you all. Thank you so much for having us here to present. First, I want to know, do I have 15 or 20 minutes to manage my presentation? I was said 20, but I see on the agenda 15 only.
I'm gonna say 15, Miguel.
Okay, I will do that. So now this first, let me clarify: the title of the agenda is not correct. I'm here to present to you the health equity plan of Pacific Source, and nothing to do with only the language access plan. So this is very important for us because it is the first time ever that Pacific Source has a health equity plan. I hope you all received in your package the summary. And so I will do a super fast presentation to allow some time for us to chat and discuss about this. So first, let me tell you that this is something that we are doing that because it's in our contract. CCO 2.0 has been very efficient trying to support the health systems to create real work around health equity. And that has been a blessing for us that we work in this area, because before that it was just basically words, right? Now it's more than words. It's in almost every TQS or RIP plan. And obviously we now have a health equity plan. So this plan was made with listening sessions. We spent some time during this year visiting the community, so community partners, providers, and the health system and medical areas to know what was the concern. And so this plan really reflects or tries to reflect what we saw from members and from you. It's a 5-year plan with yearly updates. So if you will have me again next year to give you an update of what's happening. And we identified 8 priorities. We're going to share more or less 7 with you. Basically, it's about, not yet, stay there. Oh, okay. It's okay. Yeah, you can go. Yeah, there. So basically, it's around complaints, how to help people with complaints about workforce diversity, about language access or preferred language access, understanding benefits, data gatherings, class standards, which stands for cultural and linguistically appropriate services, and obviously training on equity, diversity, and inclusion. Now, yes, please, the next slide. Let's go one by one, very fast, just to try to check with you. So the first aspect that we put in this plan, the first focus area is about help members with complaints. We know that was, for what we listened, this is a big problem, because the community doesn't feel safe doing a complaint, either because it's not in their culture, or they are afraid, particularly in rural small regions, that there will be a downside of doing a complaint. So, and we want to make sure that they understand that making a complaint is important for the system to improve. So we have several plans to try to make it better, including obviously training our people to be more friendly and support the members to want to do the complaint, but also opening other options, like to make it without declaring their name. So we are going to try several aspects around that. So this is about help with complaints. Next one, please. Yeah. So then the other thing that we listened very clearly, it was around the fact that the providers and the system in general is lacking a lot of diversity. So we understand that, and we are trying to put some efforts, a lot inside of our own company, but also to have a more diverse group of employees that reflect better the community, but also trying to support those efforts in the community. Just for instance, as an example, we have been supporting the training of interpreters that is made at COCC, and we are working together now to try to help the creation of a new program at COCC about traditional health workers. So we're trying to put money on that, not only money, but also knowledge and support to create these opportunities and grants for providers who want to engage more diverse people. Yeah. Next slide, please. So the other part is about now, yes, about preferred language access. So we know that we listen that there is a lot to improve around interpreting services, for instance, and not also to have access to that, but also about the quality. So we are concerned about that and looking for opportunities to make improvements on that. Some systems already take that as a task, but there are many other areas, particularly specialty or small clinics that are having problems to get access or to understand that this is a right for the member. And so we have some strategies to support that process, including the use of I Speak cards, which are these little cards that explain that you need that service and that you deserve that service by law, etc. Some other projects that we have. Next slide, please. Obviously, understanding the benefits. Understanding the benefits is another thing that we hear in our listening sessions that is very complex, because particularly because of the complexities in our system and the language we use to communicate with people. By the way, I did receive the guidelines to presentations, and I appreciate that you are doing this move. And that's one of the reasons why we are sharing with you this summary instead of the 40-something pages of the entire health equity plan. You will receive that too in time for you to have the time to review. But we think that making a summary was easy to access for everybody, easy to read, right? So in the same ideas, we are going to put some efforts trying to clarify our messages and use diverse medias to get to our members and our providers. Next slide, please. So here in this slide, it's the other three priorities that we have. Obviously, one of the more important is to try to be more clear and more perfectional way to get the data that we need to understand where are the inequities and how can we tackle them. So data gathering, it's an important aspect of that. Class standards, as I said before, class standards is a tool, it's a national tool that organizations are using to improve their equity strategies, particularly around language and access, but not only about that. So the class standards are 15 standards that guide you and you can use to improve the representation of the members in your organization. So 5 of them, it's focused on the leadership and then the rest around language access, and there are some also to how to engage better with communities to have a more impact in the work everybody is trying to do. And finally, understand the different needs of the member and see how can we meet them where they are. So basically it's training around diversity, equity, and inclusion, something that is new for everybody. It is new for our company. So Pacific Source has achieve a first step, training all the employees, not only those related to Medicaid, all the employees around implicit bias and the basics of diversity, equity, and inclusion. And we are making available those trainings to providers too, with some credits for those who want it. And Pacific Source is paying for those trainings. We plan to continue on this process with other strategies around that. So this is at a glance some of the aspects that we want to share with you. Now I stop, and I'm ready to answer questions and see where do you see the opportunities for us to collaborate. We want you to use the health equity plan, and obviously to work together to make it happen and to make it better. So, Michaela, are we gonna play with the stamp and the Zoom, or?
That's me. Let me put that up.
That's a way that we can.
Gracias, Miguel.
Sí, de nada. Gracias, Brad. So here are the 7 focus. When could you explain them how to use the tool on Zoom if they want to make a mark with Zoom to see which one is of more interest? Or
Miguel, could you explain? We haven't done this before. Is it the annotate button if they happen to have it? They might not have that. So what if they have it, what are they looking for?
So in the view options, if you see your screen on Zoom, you go up in the up to the right. There is a view options. You click there, and then you have a function which is called annotate. When you click on annotate, then you have a lot of things to annotate, right? To draw or whatever, and then you can draw and say, "Oh, this is mine." So you see, I just put one. There is an eraser, and then you can play with that and make your mark wherever you want, and that way we know which. Yes. So
Gwen. Gwen.
Yeah, little star.
You get my point.
Hey, Gwen, I apologize, but and Miguel as well. Miguel, apologize for you having to rush a little bit. You didn't feel too rushed to me, so good job. Hopefully that's true for others as well. But I think, can we bring Miguel back and do this exercise then, after the CAC has had time to digest the plan? We haven't seen the plan, or at least to digest what we were just presented.
Did Miguel say something about 7 tools?
I think when I said tools, I was referring to the class standards, which is our number 6 priority. The class, I will be happy to share with you an overview of these 15 class standards, which is a tool, a national tool that we can use to advance health equity in our health systems. I would be happy to. I will send you, Michaela, and maybe distribute to the other ones an easy overview of what is the class standards. And I will come back, I think on February or something like that, to present class standards, just class standards to you.
Yeah, because
this is Lauren. I'd like more information from you. I'll connect with you.
Perfect. You have my email, by the way, on the summary. Yeah. So please write me anytime.
Yeah, because we're running a little short on time, and this would be a richer activity if we're all ready to do it. Let's bring Miguel back and do that activity next time, if that's okay.
Brad, could I ask one question?
Yeah.
before we move on?
We have 1 minute.
I'm sorry, what?
We have 1 minute. I'm not over yet.
Okay. And you may not have an answer, but you may. I think this is a great equity plan, and it really addresses the member interface with Pacific Source. What I'm curious about is what diversity and equity means are you using to look at the provider side?
Yeah, provider. So obviously this plan, as I said about that, workforce diversity, we are focusing a lot inside of company and supporting efforts among providers who want to expand and create more places for workforce diversity. But that is a very challenging topic because it's a long-term topic. And we need to involve collaboration with schools and like the ones that we are doing now with the COCC and even with families, right? Because we need to convince the kids and the moms that there is a space that the health system is waiting for them, and we want to have them there, and there is work, and there is a bright future for them.
Thank you.
Yes,
Miguel, is it okay to put your email into the chat so people can contact you?
Absolutely, yes,
Okay.
yes. So thank you so much. We really appreciate this opportunity. Thank you for having us and respecting my time. So please contact me with any question. I will be happy to reach out to you and have a chat and collaborate together. Thank you, Kat. Thank you, Brad. Thank you, Michaela.
Gracias, Miguel. Feel free to stay with us or not.
Thank you. I appreciate it.
All right, let's move on to Kristen Tobias and talk to us about dental access follow-up. Kristen, are you with us, Kristen?
Here we go. I got to put my microphone down. Sorry.
Yeah.
Can you hear me now?
Yep.
Okay. So thank you for having me come back to talk a little bit about dental access, which I did touch on briefly beginning of this meeting today. But I did sort of want to say again that within Pacific Source, there has been a lot of discussions about dental access, especially in our more rural communities. This is a challenge not just in Central Oregon, but throughout all of our regions. We also cover Lane, Merriam Polk, and then Hood River and Wasco counties. And we do hear a lot of feedback from our members in those rural areas that dental access is a big issue. Some of the dental clinics might not be open full time, even before COVID hit. So a lot of folks find themselves having to travel to larger communities to get their dental needs met. So internally, we've had some discussions around, would it be helpful to bring the dental van into those communities? How can we support organizations like Medical Teams International to go to more rural communities like Lapine or Gilchrist, Chemult, areas like that where there might not be a full-time dentist in town? They also sometimes are able to have like a dental hygiene van that visits these rural communities where folks can come and have their teeth cleaned. I know that there's been some restrictions, obviously, with COVID, with being able to run those vans. But we hope in 2021, with the rollout of our vaccine and things like that, that those options might be possible again. And just kind of working with our community partners to see if maybe there is space to do some dental screenings and things like that in some of our clinics that cover, like the school-based health clinics that cover, again, our Northern Klamath area. Would there be space to have just very brief dental screenings done there, and for the children and for other community members, and then being able to refer those folks to other dentists if they need additional help. So yeah, I actually sort of had an experience working alongside one of the dental care coordinators, or the DCO, so Dental Care Organization, one of their core care coordinators, and I worked together to help a member find some local help. And I found that experience actually to be really helpful. She taught me a lot about how our DCOs, again, dental care organizations, contract with providers locally. And I think it did sort of open our eyes that specialty dental providers are really hard to come by in Central Oregon. And so again, just more internal discussions about how to broaden our network of dental providers for the local communities and our rural communities. And, you know, we're even having those discussions with part of our team at the Oregon Health Authority. And so they're also aware that this is a issue. And it's, again, it's not just Central Oregon, it seems to be pretty statewide. So, more work to be done in 2021 for sure, but we hear you and we're trying to our best to find some solutions. So please keep bringing your feedback and comments, and we just keep trying to find solutions. Did anybody have any questions or feedback or anything to share? Oh, sure. So Mandy put a question in the chat. So we work in Central Oregon. We have 3 dental care organizations. We have Advantage Dental, ODS, and Capital Dental. Each of those dental care organizations have internal case managers or care coordinators that will help our members and any members of their DCO access dental care. So those dental care managers, or I'm sorry, case managers for the DCO will make phone calls on the member's behalf to maybe find a local provider that offers a higher level of care. Maybe a local CCO member needs dental surgery and is told they have to go all the way to Portland to have that done. That's not acceptable, especially if there's going to be a lot of follow-up. So working with those care managers to find a provider in network that has a DMAP number, which is sort of the Medicaid billing number that you need to see a Medicaid or a CCO patient. And then working with that provider to see if they would be willing to see one of our members once, twice, quarterly, whatever that care plan might need, and making sure that they're willing to accept the rate. And sort of, it's like having a prior authorization to be seen by a specialty provider. So when I was working with this care manager for Capital Dental, I sort of told her the problem that we were running up against, and then she was able to reach out to her contacts in Central Oregon to find a solution.
Kristen, can I ask a quick question?
Yes, please.
Okay, Kristen. So this is Lauren. So the problem I was having, not being able to see anyone out here in La Pine, and what I was being told was I'm under advantage, and there is nobody in La Pine under advantage. So I'm not sure if I understood it. There's 2 more Capital and something else you said that
so we
take
also
care of people with OHP that are low income?
So we have 3 dental care organizations that you can choose from. So we have Advantage Dental, Capital Dental, and ODS, which I think stands for Oregon Dental Systems, but I'm not 100% sure, something like that. But if you call our customer service department, Lauren, they can tell you which DCO you should be assigned to make sure that you can see a provider in La Pine. So if
I think I'm only assigned to Advantage, and that's where you're hard pressed to, and I've heard this from other people, you're hard pressed to get into the office in La Pine. I've even heard that from like providers at the clinic have said, well, yeah, that's your health care plan, but good luck getting in.
Mm-hmm. Yeah, and we continue to hear that as well. I had worked for St. Charles formerly, and in early February, we were working really hard to bring the dental van to La Pine. We had it all organized to set up at the senior center there, and we were going to work on trying to have that dental van come out monthly and to help with some of the access issues. And then COVID hit. So Yeah, we hear you down there in South County, Northern Klamath, that dental access continues to be a huge barrier. Please know that non-emergency medical transportation is also always an option for our members. We're happy to, have a cab come pick you up, bring you to Bend or wherever you need to come. And I know that's a burden, but for a short-term solution, it is always an option. Cab picks you up at home, brings you to your appointment, drops you back off at home at the end of your appointment, or we're happy to reimburse for your mileage as well if you do have to travel for an appointment. And if you need more information about any of our non-emergency medical transportation services, I'll put my email in the chat, or Lauren, you have my email as well, or Michaela can get it for you. But I'm happy to talk more about that. In the meantime, while we work on hopefully recruiting more providers to serve our South County and Northern Klamath region.
Thank you, Kristen and Lauren. Yeah.
Thanks.
Thank you very much. Anybody who has further
Christian,
questions?
I have a quick question. Do we have a minute, Brad? Yeah. Kristen, this is Larry. We had a homeless gentleman that comes into the center here, and Gentle Dental did a lot of really good work for him. Are they part of that system, or?
Yes, they are. Gentle Dental is underneath Capital Dental. Yes, and I know they have a beautiful new clinic out on the north end of Bend, where Ulta and all that are. So yes, they are a network for Capital Dental.
Okay, thanks.
Thanks, Larry. And thanks to you again, Kristen. So we are going to move on, and I'm going to ask Gwen to, we're not going to spend as much time as we had planned on the demographics. We feel like we can push that off to our next meeting, but she'll give you a kind of brief update, and then we're going to move on to our final activity.
This is so sad.
So last month, we started sharing the data about who we are as a Central Oregon Health Council and why it's important and how it ties into state and providing services for our region. And we ran out of time, and we're moving into looking at the region's data from our data website. And so what we want to do is dive in, share that data, which is going to take a little bit of time to digest, and then have a meaningful conversation about that. Given where we're at on the clock today, what we'd like to do is propose that we carve out, 30 minutes in our next meeting or so to kind of do a quick refresh and then look at that data and have that meaningful conversation. Because this is, I want to honor that, like, this is December. It's been a heavy year, and we have kind of a fun activity planned for everyone to just get to know each other and be together and have a little bit of fun together before we close out the year. So I wanted to put that out as an option to carve out a little bit more time for our demographic data for January, and then play for the last 20 minutes together. So what are people's, thoughts on that? Need a yay or nay, a thumbs up, anything would help.
Anybody opposed to that? There's a thumbs up from Mandy, thumbs up from Donna.
Makes sense.
Linda. Okay. Real quick before, lots of thumbs up. Before we move into that fun activity, I wanted to acknowledge that Myra has joined us. Myra, do you want to present yourself? Introduce yourself?
Hey, Brad. Yes, I had just literally sent you a message. So I'm actually here at the hospital with my mom. She was involved in a car accident. So I'm making sure that she's taken care of. But this kind of really speaks to Miguel's point, where we really need diverse staff in the hospitals, not only as translators, but technician, CT. I mean, this is kind of where we're all kind of, my sister and I are tag teaming to make sure that she gets the help that she needs.
Thank you, Myra. Good luck. Best wishes for your mom. Is there anybody else who joined us late? No. Okay. Gwen, I'll turn it over to you, Michaela.
Okay, so this is going to be fun. It's going to be technologically awkward. So this is called Mingle and Move. So Imagine yourself not on a screen. Imagine yourself in a big ballroom with lots of tall tables and you're mingling around with your snacks. You're going over here and you're chatting with some folks, and then you're going over here and you're chatting with some other folks. That's what we're gonna do via Zoom. So in your meeting packet, I'll have folks who have that pull it up. There is a page that says Mingle and Move. In it is a list of some questions. What we're gonna do is our tech savvy person is going to break us into small groups of, between 2 and 3 or 4 people. We're gonna be in those small groups, and you as a small group get to select one of those questions or 2 of those questions and share out your answers. So it's just, easy conversation. And then, without knowing it, because we are in a Zoom world, your group is going to change. You will either be magically transported to another small group, or somebody else will be magically transported into your small group. You might have 2 minutes or 3 minutes chatting with a same set of folks, or you may have a little bit more time chatting with a set of folks. So we're going to be mixing and mingling and moving. Questions, because it's going to feel really awkward. Just have your questions available and chit chat, and know that you're going to be chit chatting with a variety of people over the next 15 or 20 minutes, and then we'll come back as a large group and kind of close out together.
Well, that was fun.
All right. So it looks like we have everyone back. I really enjoyed the conversation in the small groups. I was curious, what did you enjoy about the conversation? Anyone want to share?
I enjoyed learning more about people in a small, manageable space.
I think we should do it for a whole meeting.
What's that?
I said, I would like to, now that I kind of got into it, I'd like to do it for a longer meeting. Sorry.
That'd be fun. Sweet Manny says, getting to know more about everyone. I wish every meeting we did it.
Yeah.
That was fun. All right, so here's a question for the group. What is one thing that you hope for the new year? And you can say it out loud or write in the chat box. What is one thing that you hope? Yeah, I think a lot of people. Peace, widespread vaccine adoption. Yes, to go back to normal.
That's it for
love
school.
and peace.
Ability to visit family. I miss my family too.
Yeah,
Everyone in my home is still healthy.
Yep. Peacefulness. That's what I like. Peacefulness.
Grandchild.
Your first grandchild.
Wow.
Ooh.
We want pictures.
I want to go maskless.
Congrats, Kim. All right. Well, I am very hopeful for
Does that include the
2021.
closed list?
That's a great question, Michaela, because I've been in 2 or 3 conversations this week that are, now, do you really want to go back to what was before? And if not, what is it you want to leave behind?
Ooh, that is a good question.
Because everybody sort of assumes, oh, I can't wait to get back to normal. Well, when you think about it, there were parts of normal that weren't so great. Hopefully at choice about what we take.
Who's that speaking?
I'm sorry?
Who are you?
I'm Linda Johnson. I'm on the CAC board with you.
Oh, okay. I just didn't know. No, just what you said was very profound. I'm just going to make a little note of that. Great. No, that's a real good one.
Thank you.
It is.
Yeah.
Well, I think we'll have to have this on the agenda again sometime. What do you think? Yeah, some time to get to know each other.
Yeah.
All right, back to you, Brad.
Okay. Well, we have 6 minutes, right? This is our last meeting for 2020. Is there anything anybody wants to share just as a reflection on the past year? And let's keep it, I guess, kind of, no, open it up. It doesn't have to be about the CAC or your experience with the CAC, but if you have anything related to the CAC, that'd be great. It can be broader than that.
Now, I was going to say I've been very excited by the new folks that have come on to the CAC this last year. It just seems like we've really added some new dimensions to our partnerships.
I agree. I'm very excited about our work together.
Yeah, and I'd like to add that I was really thrilled that we took a giant step up by being allowed to and being able to allocate money. And because of the amazing, again, I think, amazing system that was devised, I think we did it very effectively. So I thought that's just a sea change from the way we were before.
Yeah, one of the things that that occurred to me earlier, and I was going to mention it, but was concerned with the time, is not to take for granted, the fact that we have a community advisory council to the health council board, and this whole, attempt to improve our health system in Central Oregon, and also not to take for granted that, that process of giving out almost $1 million could easily be corrupted, and because there's so many people involved with different perspectives, different mindsets, different sets of eyes and thoughts and so forth, we keep each other accountable. We hold each other accountable and minimize any conflict of interest. And, it's a solid system, I think. So it feels good.
Yep.
And Brad, I really appreciate the great job that you've been doing leading the CAC and chairing it.
Thank you. It's a good opportunity. Is there any what time is it? Is our time up? No, not yet. Is there one achievement in the last year that anybody would like to hold up as something you're really happy about, directly related to the CAC or the Health Council or health?
I just have to echo everything that you've all been saying about being able to shepherd that nearly $1 million into the community from all the places that you are of service in our communities, that you're able to come together and bring the level of rigor that was required to bring that $1 million to bear. It also felt good because I think that it gave you folks an idea of what it's like to be the Health Council and what it's like to need to shepherd community resources. It's never up to us. We're just the shepherds. We're just the stewards. So I just want to tell you how very much I appreciate you all.
The year is kind of a blur, but was it back at the beginning of the year that we introduced the new health improvement plan?
Yes.
That was a great achievement too.
That is a blur.
And don't even say the word strategic plan. Some of us have PTSD from that.
And Don, I think I speak for all of us to say how grateful we are for your leadership and for your staff. You guys just do an amazing job, and I'm really grateful for being a part of that.
Thank you, Larry. I am very grateful for the team that I get to serve as well.
One of the things that's been really fun that I think is a success is to see how each of us, as well as each of the staff, has stretched and grown and acquired new skills and been really comfortable to stretch and grow with each other. That's often not easy to do, to show up as somebody who needs stretching or doesn't quite know the way. And with this staff and this team, it feels comfortable to be real.
Well, it was just presented to us, but I'm excited about the health equity plan and making progress in that area, and also diversifying the members of the Community Advisory Council. Those are achievements. Anything else? 30 seconds.
Just really fast on behalf of Pacific Source, just thank you all so much, excuse me, for showing up every month and telling us what's working and what's not working with healthcare delivery in Central Oregon. Again, we hear you. We find this to be one of our most important meetings each month. If anything, we're telling potential presenters like they have too much work, we can't hear it all. So please know that your voices and opinions are valued. And just again, we appreciate you all. We wish you all the happiest of holidays and a safe, healthy, happy new year. And we look forward to getting to work in 2021. So
yeah.
Nice way to wrap up. Thanks, Kristen. Thanks, everybody. Have a fantastic holiday.
Yes.
Happy holidays. Be safe.
Thank you.
Stay safe.
Happy
all.
New Year.
Yes.
Thank
Bye-bye.
you.
Here.
Bye.